Hi, everybody. Good afternoon. Thank you for joining us this afternoon. And I am so honored and thrilled to be here today with a dear friend, an incredible advocate and activist, and someone who has dedicated his life in a way in which very few others will ever be able to say that they have, to trying to make the world a better place. And starting right here at home in the United States, but recognizing the inherent dignity that our government, our country is supposed to guarantee to everyone, and that yet still to this day we fail to provide. And Peter Morley has used his own story of enormous strength and resilience and perseverance to challenge the rest of us, challenge every single American, challenge our government to actually make good on those promises of seeing everybody and treating everybody equally, particularly when it comes to healthcare. Peter has been as active and as powerful and as passionate an advocate as you can find, given his own extraordinary list of challenges that he's had to confront and overcome over the course of his life. And rather than be defined by those, he continues to challenge the rest of us to make sure that others are not and will not be seen for those limitations, but will be able to be empowered by that advocacy. He has a killer Twitter account. If you do not follow it already, you certainly should. And he has been busy this week because, as all of us know at this point far too well, what we've witnessed this week in the United States Senate is nothing short of a power grab. It is nothing short of an effort by the Trump administration and by Republicans in the United States Senate to thumb their noses at the will of the American public, to demonstrate a level of hypocrisy that I would say could not be met, but for other examples of a Mitch McConnell-led United States Senate in the past several years, to put in place one of the most conservative justices who have served on the United States Supreme Court, certainly in modern times, if not ever, to be able to rush that person through, one, because of the timing of a presidential election that this president continues to try to indicate will be contested, and two, because of an upcoming hearing before the Supreme Court on the Affordable Care Act, piece of legislation that has been critical, as you will hear Peter explain, and as he's explained a number of times, has been critical in order for he being able to gain access to healthcare and for literally being able to keep him alive given the number of afflictions that he's been confronted with. And so, Peter, I think one, I wanted to start there, but first, great to see you, my friend. Normally we do these in person, so unfortunately circumstances prevent, but it is great to be with you. Two, thank you for your heart, for your effort, for your advocacy, for your faith in the rest of us, despite being given time and time again, being shown that sometimes that faith is not as rewarded as it should be. And grateful for your voice and your advocacy to try to explain to everybody and put a human face on this to say, look, this is not just an academic exercise. This isn't a question about original intent of the Constitution. This is what this means. And this is what this means for somebody that has pre-existing conditions. This is what it means for somebody that does need consistent access to healthcare. So walk us through this a little bit. What does potentially Justice ACB mean to the Supreme Court and mean to you?
Well, excuse me. Now that you got me all choked up here, thank you for that. Thank you so much for your kind words and for everything you've done. I've tried to explain this over the last few years. As someone who lives with over 10 pre-existing conditions, I was healthy until I wasn't healthy. My life changed in an instant from an accident, and I survived kidney cancer, and I live with lupus. All diagnosed from 2007 to 2020. I've had 2 brain surgeries for pituitary tumors. I've had 5 spinal surgeries. I take 38 different medications, and I live on a fixed income because I'm unable to work. I'm unable to do the things that somebody who is healthy is able to do. that, some days I'll look healthy and people will say, hey, you look great. And I'll feel horrendous inside. And I can't explain what that is, because everybody experiences pain differently. But what I've tried to engage people with is the fact that healthcare touches every single one of us. And for the last 3 years, the Trump administration, and I've testified 3 times in Congress to this, has been blatantly trying to sabotage the Affordable Care Act. And the Affordable Care Act protects, as we know, we think, there's probably more people now, unfortunately, due to the COVID pandemic, but it's probably more than 135 million Americans. And for somebody like myself with over 10 pre-existing conditions, and the Affordable Care Act also allows me to access my medications, and I couldn't afford them without the Affordable Care Act. So if I take, I said I take 38 different medications. One of those medications is for my lupus to slow the progression down. I self-inject myself with a subcutaneous biologic weekly now. Used to get it infused once a month. That medication alone, I wouldn't be able to afford. And what would happen is my disease would progress, and as unfortunately lupus has taken the lives of many people, it would probably progress and I would die. And it's not an easy thing to say. I've said it so many times now that I have to say it because people need to know that this isn't just about partisan politics. This just isn't about what the Republicans want to do and what the Democrats want to do. This is what's right for America. And ramming through a Supreme Court justice, first of all, negating Justice Ginsburg's dying wish, which is despicable in my opinion, and ramming through a Supreme Court justice who, as I mentioned, Donald Trump tried to do this through Congress. He failed. He's tried to sabotage it through the administration for the last couple of years, which I've testified to. And this GOP lawsuit, which he supports and the DOJ supports to tear down the ACA, is something that this judge, who, if her nomination goes through, supports. And what that means for you is the difference between life and death.
You do an incredible job, Peter, of making this real for all of us, right? But not just as you said, 150 million Americans that depend on, that depend on access to healthcare. All of us depend on access to healthcare, right? But that striking down the Affordable Care Act could lead to 20 million, by some estimates, more people losing access to their health insurance. What comes down with it in the hypocrisy, obviously, of this administration is a president that tries to say he's for repealing every word of Obamacare, but now is saying they want to, they're in court, the Supreme Court, yet again, challenging every single word of Obamacare. But now you've got Lindsey Graham and Ms. Barrett in before the Senate and the American public saying, well, maybe we'll just sever the individual mandate and the rest of it is fine. As if they're trying to defend it after trying to repeal it legislatively and take it to court on multiple occasions. And as you highlight, one of the things that comes down with that, if it is struck down, is the coverage for pre-existing conditions. COVID is now a pre-existing condition, right? We're seeing, obviously, early on in this pandemic still, but we're seeing effects linger in people for a long time. We don't know the impact on young children, the long-term impact on young children. We know that they seem to be more resilient when it comes to the symptoms that they exhibit. But that doesn't mean we know what the long-term diagnosis or prognosis is for their well-being, particularly for those that have shown x-rays of their lungs and the damage, the long-term damage that can happen to their respiratory system. In the midst of a global pandemic, in the midst of 200,000 fatalities here in the United States and over 8 million cases, the fact that you're trying to strike down healthcare, a law that tries to extend access to healthcare to millions of Americans, you know, and this is, here we are again.
Yeah.
But I wanted to have you talk a little bit about, or give you a chance to talk about, the chronic conditions piece, because I don't think most people wholly understand that, and what it means for those that have diabetes, what it means for those that are suffering with or struggling with mental or behavioral illness, what it means if you do need consistent access to reliable, high-quality healthcare, and what happens if this is taken away.
Well, thank you. I appreciate you mentioning that, because chronic, the life of a chronic condition, especially with lupus is something that, it affects people differently. I never know what my day is going to be like when I get out of bed. And most days it is a struggle to get out of bed. I look for different things to motivate myself to get out of bed, like fighting for healthcare and fighting for people across the United States. And, it's a very hard question to answer, because it triggers a lot of emotion for me, because we struggle so much, and the people I've spoken to, I know I do, but the people I've spoken to, they struggle every single day just to survive. They don't have the energy, and I know I don't at many times, to fight the brutality that this administration has shown. It's, when you live with a chronic condition, like I've lived with cancer, and then, there's the aftermath of it too. There's the trauma after you've had so many surgeries, after you've been diagnosed, and you always think that, you might be diagnosed again. There's I definitely live with anxiety, but I know a lot of people in the lupus community and other communities with people with chronic illnesses, I know they live with depression. And then you have, again, this administration and these GOP senators I'm not going to say that they don't care, but they certainly act like they don't care. And you brought up Senator Graham. I sat in his office and spoke with his staffer during the ACA repeal. And they told me they already had a backup plan, and that was to have block grants for states, which means that each state would decide who lives, who dies, who gets care, who doesn't. So that to me is unacceptable. It's unacceptable to me as an American. It's unacceptable to me as a patient. And it should be unacceptable to you, because you have, and I'm not talking to you, Joe, I'm talking to America right now, because you have, every one of us knows somebody with a chronic condition. You have a relative, a friend, a loved one, anyone, you know someone. So it isn't fair to them. This is not the way it should be. People complain that the Affordable Care Act, or the Patient Protection and Affordable Care Act, as it was called, patient protection being the operative words. If the Affordable Care Act isn't great, we had plenty of opportunities to make it better. And the worst part is there is no replacement plan. There's nothing. There's nothing. It's just a big lie. And that is the worst part.
So understanding that, and understanding that, how challenging this moment is for so many, we also know we're 3 weeks out from an election. And whatever, if you care about these issues, right, what should people do?
I think the most effective way is to speak out about it. You need to share your stories, but of course, most importantly, especially in red districts and red states, I mean, vote. You got to vote. You got to vote for. I mean, I would hope most of the people watching this would be voting for Joe Biden, but I can't assume that. But I know that Donald Trump doesn't care about my health care, and he doesn't care about millions of people's health cares. I mean, he may claim to, but it's so important to share your story, because if somebody like you, like a Congressman Kennedy, if somebody like a Congressman Kennedy doesn't know that you need his help with health, how is he going to help you? So you need to let your members of Congress know and share your stories. And don't be afraid to share them, because you may never get this chance again. You may never get this opportunity again. It's so important, and it does make a difference, because somebody could once have said to me, and they did, oh, going down to DC doesn't make a difference. Well, it did make a difference. It did.
And Peter, oh, go ahead. I'm sorry.
No. It's just.
I was just going to say it does make a difference, because you and I met over the efforts to try to prevent the legislative repeal of the Affordable Care Act back right in the beginning months of the Trump administration, and we did. And it obviously, as you remember, made it through the House, but got blocked in the Senate by one vote, John McCain. But there was an uproar that you helped lead, because you took your story and you told it. And rather than keeping so much of the pain that has happened to you and the unfortunate circumstances that have fallen on you, rather than taking that and just keeping it inside, you were willing to share it and show that courage and the bravery, and brought so many other people with you and said, hey, while your circumstances are unique, there are other people out there like me, right? There's the Addie Barkins of the world, right? There's the Peter Morleys of the world. There's advocates and activists that we met at rally after rally and protest after protest, names that we won't all be able to recall, but standing up for their family member, their neighbor, their friend, their cousin, their son, their daughter, their parent. And that's what we need to do at this moment. And we have this chance now, and understanding that we're on a official government website through my official office. So keeping this nonpartisan and apolitical, but we have a chance to make your voice heard and to vote on whatever side of this you so choose. But by God, don't let this chance slip away. Make that voice count for the Peter Morleys out there that are doing everything they can with every waking moment and every breath that they've got to let people know what is at stake and what needs to change, and believes in our capacity to change it. So, Peter, I'll give you some final thoughts here before we wrap up, and I'll let you get out back to your advocacy and your activism and making sure that we keep advancing the cause here.
This is, my phones are ringing off the hook. See,
I was gonna say,
you thought I was done.
It was like a landline.
Yeah, no, that's, phones are ringing off the hook. So seriously though, that's what happens when you do live. Expect the unexpected. And that's actually a very good analogy for life. Expect the unexpected. Your life, like my life, can change in an instant. And I wish to God, and I hope to God, and I pray for you and your families that it never, ever, ever does. I hope you stay healthy for the rest of your life. I really do. But shouldn't the people who are in this condition and could potentially be in this condition, and even for yourself, you may not think that you could ever get into this position, but you can. So, and it happens so fast. It happens so fast. And, you know, we all need to just join together. I mean, we're facing a global pandemic right now in our country and I mean, and obviously the entire world, something that has affected all of us, every single one of us in America. So things happen that fast. Things change that fast. So we need to remember that. We need to stand together, fight together, band together for, like Congressman Kennedy said, for the Addie Barkins of the world and people like my friend Natalie Weaver, who lost her daughter Sophia, and she was battling for Medicaid, and the little lobbyists,
Amazing.
Laura Packard, and my friend Mina Schultz, who stayed alive because she was on the ACA, was under her parents' plan. My friend Ben Jackson, who lives in Massachusetts, his daughter Emma.
100%.
Just, we're all in this together. We're all Americans. We need to support each other. And this is not a partisan issue. And I've tried to tell people that on both sides of the aisle. And I'll keep saying it. But I need you, and Congressman Kennedy needs you too, to speak out as well, because we all need. This is going to go on way past the election. We got to fight. We're going to all be in this healthcare fight for a very long time, but we need you in this fight. We need you to fight with us and for us. And stay strong, stay healthy, stay safe, wear a mask, and wash your hands. And remember, when you vote, remember you're voting for your life and the lives of others.
Amen. Peter, thank you. Grateful to be with you, my friend.
Thank
Stay
you so
safe
much.
and stay well.